and welcome to EULAR TV and this special Scientific Digest session from EULAR 2022 at Copenhagen. My name is Mrinalini Day. I'm an academic rheumatology trainee based in Liverpool in the UK. Today, I'm delighted to have with me Ricardo Ferreira, who is a specialist nurse in rheumatology. We will be discussing an EmuNet Presents session, which is happening on the Thursday of the Congress, on the importance of patient involvement and the involvement of the wider multidisciplinary team in research, which I'm really excited about. So would you like to tell us just a little bit more about yourself, Ricardo, and also your involvement in the session?
Sure, my pleasure. So I'm a clinical research nurse working in Coimbra, Portugal, and I'm doing most of the time research. So working with the patients and trying to spread the word how the EULAR works also into my country. And that's, I think, one of the reasons that I'm participating in this session.
Great, and we're really delighted that you're going to be joining us for this session. And specifically, you're going to be talking about citizenship involvement and the involvement of the wider multidisciplinary team. Mm-hmm. Could you maybe talk us through a little bit about why this is so important specifically for you and your experience in this area?
Yeah, in terms of science and research, there are different types. There are the basic science, there are the pharmacological or clinical science, and there is the science that tests, for instance, interventions, complex interventions like the effect of physical activity, the effect of educating the patients about a given treatment in a given way or in another, and this requires specific skills. That's why it's important to have also health professionals included in a multidisciplinary team testing this, because we support, and I personally support, that health professionals should participate in the research led, if we can say, by the physicians, but in the other way around. Also in topics that are naturally more related with health professionals, the physicians should be also invited. But the central piece here and of this session is the involvement of patients.
Absolutely. Yeah.
And since the time that I joined this EULAR family, it was incredible to me, who came from a different area, how the patients were valued and their participation in research. Of course, there is always space for improvement, and that's also the reason of this session is happening today, because we are never completely satisfied. But as mentioned, EULAR was an example, and still is, to me, how the patients and the public are involved. And in this session, I try to show also how myself and my team are trying to spread the same model into Portugal.
Yeah.
For in the research made by rheumatologists, it is easier. Not completely easy to include patients, but it is easier. But into other fields, it's really like if we were starting to show why and to show how and to try to give the example. And I'm also giving some examples about this and how we have been doing it in the last years.
Brilliant. I completely agree. It's something that came up in the plenary session, the opening session, sorry, today, and we heard some really powerful testimonies from patients and members of the HPR team as well. And EULAR has really driven forward the involvement of patients through their PARE initiatives and similar as well in research. And personally, I've found that really helpful as well to speak to patients who've been involved through EULAR. Mm-hmm. Can you maybe give us a taster of something you might be speaking about in the session, about your own experience, maybe, and how EULAR and the PARE maybe have helped you with your own research?
Yeah, I will give some practical examples, namely suggestions, comments, reviews on the papers, on the projects made by patient research partners. Of course, that I've been lucky of working with some of the best, some of the mentors and the teachers, but in different occasions I've invited, for instance, an international patient partner, a national one, and a local one. And
Yeah.
of course, when we go closer, the expertise or the training they receive is not the same, like the patient research partners who are giving lectures here at the Congress. But it's very interesting because although the patients from our departments do not receive the same training, and you are needed to give them more feedback, more preparation of what is expected, etc. Their insights are more, how can you say, more innovative or unexpected. And when speaking about the importance of including patients with my colleagues, now I know that I should start by remembering my colleagues that patient does not mean elderly, and patient does not mean not clever person, because
Absolutely.
everyone can be a patient and will be for sure during a given part of his or her life. And having other feedbacks like sociology or architecture or design, they will bring you, and you will not expect, but they will bring you good insights and explanations and food for discussion, namely when you are analyzing the data. But another important message that I'm trying to bring here and also at home is that involving public and patients, it's not only to invite them to participate in the meetings and to see if they approve of, if they have comments. It's also to invite them at the very early stage when you are drafting the research questions.
Yeah.
Because the money is not unlimited, and we need to be very careful where we spend our money. Even if we have money to spend in doing surveys or collecting analysis, if there's not a practical purpose understood or shared by them, we should question ourselves. Is the best way to spend our time, our money, the money of the society, or should we think better on the priorities? And sometimes the patient involvement is still missing on these early phases, or sometimes not valued as it could be.
Absolutely. We need to make sure that the research we are doing ultimately is of benefit to our patients and is relevant to what their needs are and what their wants are as well. I have one final question for you. Ultimately, this session you're presenting at is an EmuNet Present session, so very close to my heart because I am a junior trainee in the field. Why do you think it is important for up-and-coming rheumatologists to be aware of the importance of patients and the multidisciplinary team in their research?
It makes all sense.
Yeah.
It will become more natural, isn't it?
Absolutely.
It's also for me a pleasure to participate in this session, as I am also an EmuNet member.
Yep.
So I hope that all health professionals join as well to this great community. And like the children, when we are put in contact with a given situation on early phase, it will become more natural and
Exactly.
be more spread, and we can learn from each other, from the experienced people, from the more innovative and rebel and more enthusiastic young people, and also diversity and equity is important in terms of also on the patient selection to the projects. Like I mentioned, we should not only select the very known ones, the very well trained. It might be easier, but they are also not so many and will not be enough for all research projects. And I think that young rheumatologists and researchers can also have an important role in starting or implementing new networks and new training patients or collaborating in the training of patients to be involved in research and also in education, which is something that we don't speak too much. We speak a lot on research, but patients can also be good educators to train clinical assessments, to train clinical interview. And there are some steps on that direction, but we are here to improve and to hear new ideas.
Absolutely. Thank you very much, Ricardo, for joining us today on EULAR TV. You've given us a lot of food for thought in a very short space of time. I'm really looking forward to the full session and to hear more of what you have to say. Thank you very much for joining us for this Scientific Digest, and we hope you enjoy the rest of the conference.
Thank you.